but it's not working. So now I'm forced to stream vertically. And I want to just give us an overview of this acne, the causes, the symptoms, the prevention, and proper care. So the thing is that acne is a highly common skin condition that affects people between 10 to 40, 50 years. In fact, it affects all ages depending on how your body is. Okay, you know from children from 11 years and above, it actually affects people from 11 years and above. So it's characterized by plucking your hair follicles, the pores, excessive sebum production. That's the face oil, dead skin cells when it's not shed properly, and it also affects is also being caused by bacteria of all kind. So this acne actually appears on the face, on the chest, at times you see it on your neck, even at your back and all that, or really other places of your body, but most especially it affects these places that I mentioned. So people, it is always characterized and seen mostly people on puberty age, right? So generally affect people of all ages. So now let's talk about the causes and the triggers and all that. So when we talk about acne causes and trigger, what comes to your mind? If I should just talk, so what actually comes to your mind when it comes to all those causes and triggers? So we have biological factors, not only biological factors, we have hormones, we have genetic factors, we have external factors. So when we talk about biological factors, is primarily it caused by production of oil, sebum production, dead skin cell, bacteria buildup, and all that. So when it comes to hormone, estrogen increment, androgen increment, puberty, hormonal fluctuation, such as pregnancy, menstruation. It can stimulate the oil glands and make your acne worse, or maybe make you prone to acne. So there's also genetic factors whereby your family history, people in your family, they have a lot of acne, and people in your family have acne. So that one is also one of the factors. So we have external factors. When we talk about external factors, maybe the weather condition. So that one is an external factor, can even prompt your acne, can trigger your acne to come out. So another one is diet. When you are not having good diet, and when you expose yourself to too much high glycemic, high glucose, high sugar foods and all that, it can still trigger your acne. And again, dairy food, which is such as milk, can actually worsen your acne, depending in some people, not all people actually. So there are also people whose stress can actually affect their acne, can actually bring out the acne or cause or trigger the acne. So it depends on your body or your skin type especially. So now we have symptoms. When you talk about symptoms of acne, it can actually manifest in several forms. You know why? Because I actually made a post. If you go through my shorts, you see that I actually made a post. I actually made a post on different forms of acne. Your acne can come in form of whiteheads, can come in form of blackheads, can actually come in form of papules. I made a pictorial diagram on my last post actually, and it can actually come in form of pustules, and it can come in form of nodules and cysts. Now let me make an explanation of what I mean by whiteheads and all that. So when it comes to whiteheads, we talk about, you see something like clogged pores that is closed, and you see whiteheads now from the name. Then blackhead is always open, it has a clogged pores, and eventually you will see that blackheads on your skin. Those blackheads most especially occurs at your back and your chest. Those ones are very, very disgraceful. So we have papules. Papules are small inflamed acne with tender bumps, right? So pustules, P-U-S-T, the pustules with pores on the table. Let me don't bore you with all these things. We have nodules, which are large and painful. We have cystic acne, which are they are deep, they are painful, they are under the skin, they are always filled with pores. Yay! This acne is a dangerous thing. So we talk about the prevention. When we talk about prevention can vary. You can prevent it if you are genetic, it's inevitable. If it's genetic, it's inevitable. So you have to manage it. That's where skincare. Oh, my phone. That's where that's where skincare product comes in and skincare maintenance. So we talk about gentle cleansing. You should have wash your face daily, twice, depending with mild soap and everything, oil free cleansers, with warm water to remove the dirt and excessive oil, but avoid harsh scrubbing. Those people that used to scrub their face most of the time, avoid scrubbing your face. So we talk about non-comedogenic products that don't clog your pores. Look out for product that doesn't clog your pores. It's very important. Use makeup, sunscreen, lotion uh, that are labeled non-comedogenic products. Is very important so that it will not go and trigger your acne. So now we talk about hygiene. Most people feel like when you are not clean, that's when your acne will always come out. No. Although hygiene is one of the factors, it's better for you to be on the safer side. People that that sleep on dirty bed sheets, wash out for where you're sleeping, how clean your bed sheet is, how clean your pillowcase is. And people who do makeup all the time, try and remove your makeup and remove it properly before going out, or maybe before sleeping, so that you cannot transfer those makeup on your bed sheet or on your pillow and end up using it over and over again, accumulating bacteria of all kinds. So now another one is avoid touching your face. For people that used to touch their face, any small thing, they'll just be touching their face like say their face is one thing. So if you're the type that is touching your face, avoid touching your face, and so that you can prevent transferring those bacteria on your fingertips, or maybe the bacteria you have touched from another surfaces. Avoid transferring it to your face. All right. So now we talk about sun protection. Sun protection is very important. The use of sunscreen is very important because it will prevent you from UVA, UVB filters. And while using those sunscreen, use the ones that are oil free. Very, very important. So now let's talk about the proper care and treatments. We have a lot of treatment out there, and people who even generate their own treatments. Now let me tell you, you have to speak with a professional, a skincare consultant, a pharmacist, a dermatologist, a doctor, aestheticians. Speak with people who are in the field to help you. Don't go and this triple therapy, or okay, let's say triple action creams. Don't go and start applying triple action creams because
low battery, please charge.
My battery. Don't go and prescribing for yourself because you felt like this is going to give you a short treatment, a short miracle, and end up damaging your skin. So we have a proper acne over-the-counter product that can be prescribed by your pharmacist, your skincare consultants, your dermatologists, your estheticians. Just try and talk to someone who is a professional on the field, at the field, anyone in the field, something like that. So when you get the over-the-counter drugs, we have a lot of it. We have benzoyl peroxide, which is my favorite. If you go through my videos, you will see where I made videos on benzoyl peroxide. Benzoyl peroxide has always been my favorite over the years, and it's non-negotiable. It's non-negotiable. We have tretinoin. Those ones are prescription drug or prescription creams, so don't use them if it's not prescribed. So we have salicylic acid, we have azelaic acid, we have sulfur. Most people neglect sulfur. Sulfur is one important over-the-counter cream that can use to manage your acne, and but because of the deposit they used to give us, some people neglect the effectiveness or even the use of sulfur, and it's economical. It's actually economical and is wonderfully doing well. So I don't blame people neglect economical, something that is cheap. They feel like cheap things are not working. Most times Those ones you neglect are actually the one that will save your life. Don't worry. Now, over to, apart from those ones, at times when treating your acne, it may require you getting, over the counter medication and over the counter creams for synergistic action, for synergy to work better and work faster. And we have topical retinoids, those ones are prescription, those ones will help to even shed your skin, and it has an anti-aging benefit as well. So depending on the kind of treatment you are getting, make sure that the treatment is being prescribed by a professional. Don't go about prescribing for yourself, or prescribing or getting treatment from people who are actually not in the field. Because some people will tell you, hey, I have acne years back and I use so products and this one. Anyway, verify. If you don't have the money to pay a professional, just verify from the 100% source, okay? So again, if you are doing all those stuff and you don't have patience, you have to have patience, and you have to have consistency skill, and you should also be anyway this you have to be zealous. You have to know that, okay, this is serious business, we need to treat this and treat it properly well. So I think acne is something that we're not making awareness enough about, and is something that is affecting all ages, and we need people to know more about this acne, how to go about it, how to treat it, and how to seek professional help. So I will be coming back tomorrow to also tell us more about this acne before I digress to another topic. So see you guys same time tomorrow on live, and don't forget to subscribe and share my live video. I love you. Bye.